So excited to welcome everyone to the Zoom webinar. Tonight, we are going to discuss heart disease in men and CBD. Now, the entire month of June has been really fun because Father's Day is on Sunday. So I thought it best that every single Wednesday in the month of June that we pick a topic that really affects the men in our lives and the men worldwide. So tonight we're going to discuss heart disease. And we know that men typically do not enjoy or desire to go to the physician or seek medical attention. So these are some really crucial points that we want you to take notes because you're going to hear from some experts in the field. We want you to take notes so that you can take this information back to those men in your lives that you love. So I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana. I'm one of the co-founders, and I also represent the pillar of health. So it's my job to really bring to you information, cutting edge information as it relates to this amazing plant that you see on the slide, the cannabis plant in our health. We are a company that sells and really markets to the marketplace or to our communities at large CBD products. We have products for everyone and every sort of condition that they want to address. We can't make any claims. The FDA doesn't allow us to make claims that our products could cure or treat. We can't make any diagnosis, but we are going to share with you some science, some data tonight on how this plant can be effective in those who have heart disease. So a little bit about our company. Actually, we're a movement. You know, we have a vision statement that is a very profound vision statement. And our vision here at Wakana is that we exist to end the negative stigma. When you say the word cannabis, most people think about weed. They think about getting high. But tonight you're going to learn that there's a part of the cannabis plant that actually has absolutely no compounds or components to it that can get you high, but it addresses the health and wellness of people. So we want to end the negative stigma. We want to help our communities that really have been hit hard on the war on drugs, have suffered from the cannabis plant, and really show them how this plant can not only improve their health, but even their wealth. So our mission is that we are a catalyst to stir a movement that inspires people like you on this webinar to find your place in the cannabis industry. Maybe you're interested in investing or a formulator, or maybe just a consumer or even an entrepreneur. So evoking the courage and strength of people like you on this webinar to really take back your health in a holistic, organic, and natural way, to take back that freedom that you may have lost in that 9 to 5, to start to look at an industry that is going to be the most wealth creating industry that we're going to see in our lifetime, where we can leave a legacy behind. So the 4 co-founders I want you to meet, Melissa Boston, the CEO, is the visionary behind Wakana. She brings to us over 29 years in the direct sales industry. She was in corporate America for about 15 years when she fired her boss at the age of 32 and a half years old. She's built businesses in over 40 countries. She's trained over 50,000 distributors. She's a social media strategist. She's an author, and she is an amazing, phenomenal leader. And then our president, Dr. Patricia Van Pelt, is a state senator. She's serving her 3rd term here in Illinois. She's a businesswoman. She's an entrepreneur. And then our fabulous Phyllis Nash. She's our senior VP of sales. She also brings to us over 30 years of entrepreneurship, not only in the restaurant business. If you're from Chicago and you know anything about Leon's Barbecue, she put Leon's Barbecue on the map here. Also, she's had 30 years, not only in the restaurant, but in real estate and in the liquor industry. And then myself, Dr. Rita McGuire, I'm an obstetrician gynecologist. Yes, I deliver babies. I'm here right now on call. Thank God we don't have any ladies in labor right now, but I bring to you over 30 years in the field of obstetrics and gynecologist, and truly, I'm an advocate for the cannabis plant. In fact, I was asked to testify for the adult use law here in Illinois in front of the Judiciary Committee. So all four of us bring to you a lot of expertise. We're pioneers in this space and so excited to bring you some information. And it's about cannabis. So cannabis, the plant, has two species. And this is probably one of the most important parts of tonight, that you have to understand that there are two species in the cannabis plant. Now, this plant makes over 100 different compounds. The two most common compounds that we talk about is THC, or delta-9 tetrahydrocannabinol. That's a really long word, but THC, that's the part of the plant that gives you the high or the euphoria or the paranoia, right? And then we have CBD, cannabidiol. That is the part of the plant that is non-psychoactive. It doesn't give you a high. It doesn't give you a paranoia. You don't hear things or see things. But what it does give you is the health benefits. So the plant has two species, one being marijuana, that's the part that gets you high, and one being hemp. That's the part of the plant that gets you healthy. So we're going to talk about the hemp species because in 2018, on a federal level, after 47 to 80 years, depending if you're going to start from war on drugs in 1970 or if you want to start back in prohibition, but after 80 years, we're going to say, cannabis was a Scheduled I drug. It was a drug that was deemed to have no medicinal properties, absolutely very high addictive potential, and a very severe safety profile. But in 2018, they descheduled hemp. They descheduled the species that we talked about that gives you the health without the high. So now we're able to do research on the components or the compounds like CBD on humans because it is legal on a federal level, not only to sell, but to consume and to cultivate and grow. So just know that our products that we're going to talk about tonight, one, will not get you high, and two, are legal to use and to sell. So CBD is an abbreviation for cannabidiol. It is the most common compound found in the hemp plant, but remember, you can find it in the marijuana species or the hemp species. But tonight we're going to talk about CBD that comes from the hemp species, and I've been using CBD in my practice for the last 3 years. I've used it in conjunction with traditional pharmaceutical medications. So when we look at the whole plant, we can see there are other components. We talked about THC and CBD, but there's CBG and CBN and CBC. But what we want to concentrate on is the hero. And they all have medicinal properties. They all have medicinal benefits. They all do a lot of things for our body that is good. But it's CBD that I want to go over some of the benefits that you find. Now, there are 20,000 peer-reviewed articles as it relates to CBD, and you can use your favorite Google or your favorite search engine and do your due diligence. But here are some of the important medicinal benefits that CBD has. CBD can relieve pain. It can relieve anxiety. It can reduce inflammation. It can help relieve psychosis. It can also stimulate the appetite if it's needed in those patients who are either undergoing chemotherapy or maybe they're HIV positive, AIDS wasting. It helps to reduce nausea. It can help reduce seizures and convulsions. It can prevent the nervous system degeneration, meaning that in those people who may have a degenerative condition like dementia or Alzheimer's or Parkinson's, or even have had a stroke. It can help with the nerves as well. It suppresses muscle spasms in those who have multiple sclerosis. It can manage blood sugar, it can treat skin disorders. It can inhibit cancer cell growth. It can reduce the risk of arterial blockage. And we're going to talk more about that tonight because we are talking about heart disease. It can increase bone growth. It can kill or slow bacterial growth. So there's a long list of benefits that CBD has on the body, as well as many disorders that have been found in research and data to help with. So the next question you may have is, how does it work in the body? It sounds like a snake oil, Dr. Rita. It sounds like it's a magical potion, but it really is a science behind how CBD and the other compounds that the cannabis plant makes when you ingest it. And that science is called the endocannabinoid system. And just think of it like this. Many of you, or most of you, may take a multivitamin, right? Or many of you, or some of you, most of you may take a Tylenol if you have a headache. Well, these receptors that are in the body, just like the receptors that are in the body when you take a Tylenol and your headache goes away, well, we have receptors in our body that is looking for CBD, is looking for the compounds that the cannabis plant makes to put the body back in balance, or to put the body in what we call homeostasis. So these receptors are found in the entire body. They're found in almost every organ and gland in our body, from our brain to our central nervous system, to our immune system, to our periphery. You can see in this slide the bone marrow, the testes, the ovaries, the uterus, the stomach, the kidney, the liver. Every single organ and gland is looking for cannabinoids to put the body back in balance. So that's how CBD works. When you take it in, it sends a signal and says, hey, Dr. Rita's knee is hurting, decrease that pain, or Dr. Rita can't go to sleep, release some more dopamine and serotonin so she can go to sleep, or Dr. Rita can't, function because she's a little anxious. It helps to calm her down. So this is a real science on how CBD works. So let's now move on to our topic tonight. Now that you have a little bit more understanding about CBD and what it is and how it works in the body. So Dr. Tai Crawford, I think I met her maybe 4 or 5 years ago. At the time, I entered a bikini contest. It was a weight loss contest at a gym. And I met her at the gym. At that time, I was over 211 pounds, and boy, did I need to be there. But I'm telling you, she is a powerhouse as it relates to fitness. She is a physician that did her undergrad at University of Illinois in Urbana-Champaign. She then went on to medical school at the University of Illinois here in Chicago. She did her residency in family practice at Rush Presbyterian, St. Luke, and did a fellowship in primary care sports medicine. And I'm telling you, these women tonight are amazing, but they're brilliant too. So I'm going to bring up Dr. Taya. She's going to talk about heart disease in men, and I will be right back. I'm going to let you share your screen.
Okay, thank you, Dr. Rita. I am excited today here. Let me get the screen share. Okay, great. So once again, thank you, Dr. Rita, for inviting me and being able to share during the Men's Month, Health Month, and just give some awareness to heart disease for our men and CBD. So I just want to jump right into it and say, well, what is heart disease? Heart disease is a combination of different health issues. You may have heard of coronary heart disease, and we know it as clogged or blocked arteries, which may lead to heart attacks. And then heart disease includes angina, which is basically just a turn of chest pain, which usually doesn't lead to heart attack, but you have the bothersome chest pain that can occur. Then the common disease is called heart failure. And there's different causes for the heart failure, but some of the common symptoms that people have would be shortness of breath, and that will give you fatigue because you're overworking to breathe, and sometimes you have a cough, but ultimately it's your heart not working properly and backing up the fluid. And then some people have what is common leg swelling. And then there's arrhythms, which are irregular heartbeats of the heartbeats and with palpitation. And then heart disease entails children with birth defects. So it's a wide range of types of heart disease. And so the important thing I want everybody to kind of realize is that heart disease is common, and heart disease, especially for men, is the leading cause of death. And this is just a diagram from the CDC, and it's from the years 2015 and 17, where it's showing all over the country men over the age of 35, and how you can see that there are a lot of heart disease. And the little boxes on the side with the color, the deeper the color, that's the more the rate that happens. So that there are 100 per color shade. So you can see in the, I guess, deep south, there is dark, and there's a lot of heart disease in men over the age 35. And that could be because, like I said, people are having the coronary heart disease, the angina, but it's concentrated there. And so how do I know if I have heart disease? And men and women can present the symptoms differently, but men can have lightheadedness, shortness of breath, chest pain, even sometimes back pain. And there's vague symptoms of nausea because there's a lot of different mechanisms that are happening, and hormones, and causing nausea, which is just a very generic symptom, but it can occur when you have the group of other symptoms. And also you can just sweat for no apparent reason. So those are some of the signs, as I said, depending on what type of heart disease you have. So I just want to discuss the common heart disease, and one of it is hypertension. And hypertension is basically blood pressure, and that's the force of pressure against your blood vessels. And so we want to maintain a normal blood pressure of 120/80. As we get older, our blood vessels kind of get stiff, so we don't need to be as low as that when we get older, over 65. But for the majority, the best blood pressure that we can have is 120/80. And then it also shows the different causes of high blood pressure. But one of the main causes of high blood pressure is unknown. We call it the silent killer. So you want to be able to follow up with your provider and get periodic checks on your blood pressure. But also it can be genetic. You can also have abnormal blood vessels. And one of the things is stress. Stress in our life can elevate the blood pressures, do different hormones, and I'll discuss a little later, cortisol, that can increase stress, and therefore inflammation, and therefore the hypertension. And then other reasons also can be some of our medications can actually elevate the blood pressure. You do want to discuss with your provider what's best for you, but also understanding all medicines that we put in our mouth, and even over the counter, have some side effects. And then other health conditions, diabetes, high cholesterol, those things can cause hypertension as well. And one of the more important things too is, as we know and has been hearing in the pandemic, that there are disparities with African American people of color. And unfortunately, more than 40% of African American will have 50%, over 40% will have high blood pressure, and only 10% of that will be considered controlled. So we kind of need to work on that, because we want to live longer lives. And so African-American men are 3 times as likely to have heart disease caused by high blood pressure as compared to Caucasian. And then another heart disease that I mentioned before was coronary artery disease, and we call that a heart attack or myocardial infarction, MI. And the first diagram kind of shows you what a normal coronary artery looks like. That's the large vessels in your heart. And you have normal blood flow and you get to all your vital, blood gets to all the vital organs. But over time, if you have cholesterol problems, as I said, stress can cause inflammation and thickening of the blood vessel walls. And you can see that over time that diameter gets smaller with the plaques and cholesterol, and then therefore you have less space to have blood flow. And that's how you can have an increased risk of having a heart attack, because there's not a lot of blood going to the heart. And it just kind of shows different locations where there's damage to the heart and a heart attack. And then lastly, I want to talk about one of the more common heart disease is heart failure. And it can have different causes, and therefore there can be different symptoms. But as I mentioned before, one of the common symptoms is because your heart is not pumping correctly, you may have what we call a back of a fluid and fluid in your lungs, and that gives you the shortness of breath, and that gives you a cough because there's triggering a fluid in your blood and your lungs. And when you're working hard to get to breathe, you can be fatigued or kind of get lightheaded because you're not getting all the oxygen to your vital organs. And so those are, some of the symptoms depending on the type of heart failure that you have. And then so the good part we're going to talk about is how we're going to treat how is heart disease treated. And largely it can be prevented. So we want to talk about regular exercise, and exercise doesn't mean you have to go out and run a marathon like I do, but just walking 30 minutes a day, starting 5 minutes, 10 minutes, 15, just to get a goal of 150 minutes per week, and you just divide that up throughout the week, and just leisurely walking. If you still in this COVID situation don't want to go out, which is understandable, you can walk around your house, pretend walking, and get that exercise in. Also, looking at what you're eating, you want to get more fruits and vegetables in your diet, less processed foods, dyes, meats, because those processed meat foods have a lot of different things we really don't understand about, but also salt, and that can elevate blood pressure and also cause inflammation, as well as cigarette smoke. If you're smoking, please everybody stop, because that benefits also cancer as well. But in addition, you want to, if you talk to your provider, see if you're a candidate for aspirin as well. And then depending on the type of heart disease you have, most people would be on different categories of medication. We call it beta blockers, statins, which is basically cholesterol, ACE inhibitors that help remodel the muscles, diuretics, water pill to get some of that fluid off if your cause is from heart failure. And then if the medications are not working, or if you have a blockage, that's where you hear the term angioplasty or stent, where there's a balloon in your major arteries that kind of open up. So you can open up that plaque and get more blood flow to your heart. And then lastly, there could be just a major surgery where you hear the triple bypass when there is a repair. And we're excited about talking about there's more studies that are out there, but we know that hundreds of years, other cultures have used essential oils, but also the CBD too has been helped to help out the heart disease. And I know these are a lot of technical terms on this slide, but just kind of want to show that the first slide at the top there, the cannabidiol, the CBD, helps out to have anti-inflammatory effects. It also help protect the vascular, what we call blood flow cells. And then when I talked about the cholesterol, the atherosclerotic effect, it helps that out. So there's more studies that have shown that cannabidiol CBD helps out with the heart and protects the heart. And then once again, as Dr. Rita mentioned, that there are receptors in the wall. CB2 is one of the receptors that you can see, as this schematic shows, that if we can replace the CBD, we can maintain balance, homeostasis, in the heart, and have some protective effects. And so major benefits of CBD are, as I mentioned, the anti-inflammatory properties. And what people may not realize is that secondary stress, as I mentioned, can cause inflammation and anxiety. And so there are chemicals in the body, the serotonin and the dopamine receptors that need to be in the right balance, and CBD can help that out to help with the effect of the anxiety and the stress. And also it's found that CBD, through research, also is like a natural dilator that helps decrease the blood pressure so that you don't have that hypertension, which is one of the risk factors. And then lastly, there's a stress hormone called cortisol, which I mentioned earlier, that we want to keep that in a low level, so it's not causing a lot of inflammation. And then this is just another picture here of how over time you have the early inflammation and then the advanced inflammation, where you have the blockage in the arteries, and the inflammation is one of the major things that goes on in heart disease. And then lastly, I wanted to talk about there are research out there now, and there'll be more research now that the CBD is legalized, the recreational amount. But here's are some articles from the British journal, where it has shown that some positive effects in animal studies have shown that there are improvements, especially with the high blood pressure and the anti-inflammatory effects, that CBD is very beneficial. And here's, not only just anecdotes that you hear from people, but there's also research. And in addition, one of the studies that I was able to locate was in 2006, in a Korean study that had a study where the subjects inhaled lavender and with some other essential oils, and that improved catecholamines, which is like an excitatory hormone that's important in heart disease too as well, and it also decreased heart rate and blood pressure. And also, you may have heard cinnamon helps out with regulating blood sugar, but it also helps reduce heart disease risk too as well. So in summary, it is very important to understand what heart disease is and what are some of the symptoms. And there's a lot of risk factors that can cause the heart disease. But largely, it's the inflammation in CBD and the effects of the aromatherapy from essential oils can help decrease that inflammation, and therefore we postulate that would help out with heart disease. So if we can maintain our stress and anxiety and cholesterol levels, that can help too as well. So overall, CBD, in addition, if you do need to take medicine, can be adjunctive to improving your heart disease. And I want to thank everyone for paying attention there, and hopefully you gather some information, and just happy to have more people be aware of heart disease, and especially want to make sure our men live longer, because we want you to be around with us.
Thank you so much, Dr. Crawford. Can you leave that slide up for 1 second?
Oh, sure.
If you have any further questions later on down the line, her email address is there, drgreenleaves.wakana@gmail.com. Please utilize all of the healthcare professionals that are collaborating with Wakana. So we are all here not to be your physicians. We are not your private physicians, but we are absolutely here to answer questions, not to give medical advice. So that's really, really important. So thank you so much. I'm going
Yes.
to share my slide. We want you to put your questions in the chat area, and we're going to take your questions after each one of us has presented. So thank you again. We want to keep our men around, absolutely. That is so, so important. So we are going to move on here and let's see. I'm going to bring up Dr. Joy Smith. And Dr. Joy Smith is a PharmD. So she's got her PhD in pharmacy. She attended the Florida A&M University. I'm going to see if I can find my slides. And tonight I found out that this is a brilliant woman, right? She went straight through 6 years, straight through undergrad and received her PhD in pharmacy. So this woman is truly another powerhouse. And I want to bring Dr. Joy Smith up because we understand that essential oils, as Dr. Tyus mentioned, can be advantageous when we talk about heart disease. So we're going to talk about one of our most popular essential oils here at Wakana. And I can't find my slides now, so you can share your slides, Dr. Joy Smith. Thank you so much.
Okay, not a problem. Dr. Rita, can you hear me?
I can.
All right, let me open this on up here. All right, so good evening, everyone. As Dr. Rita said, I am Dr. Joy Smith. I am a pharmacist at the Cook County Hospital. I've been there for about 7 years, and I'm just so excited to be able to get on and share about the wellness benefits of these oils that I love so much. So like every day, I'm learning something new about a plant-based oil, how they can heal, and it seems like every day there's something new coming to my attention. So black seed oil is no exception, and it's truly just blown my mind with all of the benefits. Now, this evening, we're specifically going to talk about heart disease, but it just has so many amazing benefits. I just can't stand it. So let me get here. This is me in my element. So for those of you who don't know me, like I said, I'm a pharmacist by day, but I'm a plant-based oil fanatic by night. And I've been trained in traditional medicine, but I've been practicing as a pharmacist for 8 years. So I've been kind of educating myself on both sides of the spectrum. But my real deep dive into wellness and like plant-based healing was when my brother got diagnosed with cancer in 2014. And he's fine now, thank God. But when he was diagnosed, I saw him just take charge of his health and explore the world of natural healing, including a plant-based lifestyle and how plants can heal him and how he can just use the things that God has given this earth to heal his body as opposed to synthetic medications and those types of things. Now he had both sides of the spectrum, but he tried the plant-based approach first and then used some of the traditional methods. So his life change and his ability to take charge of his health kind of prompted a change in me to learn how we can use food and other plant-based components as medicine, just like our ancestors had years and years ago. So while my pharmaceutical training taught me that medicine is first line for healing, I just continued to watch how the medical industry would profit as people get sicker. And I mean, there are a bunch of great doctors out here. We have 2 great doctors on the line right now that really, truly care about people's health and well-being. But the system overall just continues to profit as people get sicker. And I knew that I wanted to kind of explore the holistic approach to wellness so that I could have an opinion on both sides. So my aromatherapy certification after school, and now my online dispensary with Wakana has just fed my little plant-based soul. And I'm just so excited. In this picture here, you see me teaching about essential oils, and that's really my happy place. So tonight I've been charged to talk about how our specific black seed oil can help with heart disease. And when we talk about heart disease, the reality of the situation is that it's one of the leading causes of death worldwide. So our doctors can work hard to treat symptoms and manage patients with heart disease, but it's up to us who are prone to or currently living with heart disease to support our bodies in healing themselves by being proactive instead of reactive when symptoms get out of hand. And one way that we can do that is to take in what our bodies are already looking for, what our bodies are used to breaking down. And what I mean by that is taking in plant-based matter, such as CBD, such as essential oils, such as good foods, lots of water, those types of things that our body recognizes and doesn't have to work so hard to break down to be used by our organ systems. So now we get to our black seed oil, and this black seed oil, heart disease is just one of the things that black seed oil helps with. There's tons of other uses, but I want to focus on this black seed oil, and Dr. Tyus did such a good job of setting up how, what heart disease is and how it works in our body. And Dr. Rita is going to educate us very soon on how our CBD products can assist. But keep in mind that Wakana has essential oils. And one of those essential oils is the black seed that happens to have a major impact on heart disease. So for those of you all that may not be familiar with essential oils, you'll have the common name of essential oils, but you'll also have what's called the chemical name. And the chemical name for black seed oil is Nigella sativa. And it contains an active ingredient that's called thymoquinone. Try to say that 3 times fast. Now that thymoquinone is cardioprotective. It protects the heart. And what does it protect the heart from? So when people have heart attacks, the tissue of the heart around the heart called the myocardium suffers a whole lot of damage. And what black seed oil can do, it can aid in saving those tissues around the heart muscle. And it can also promote overall heart health, even if you don't have heart disease necessarily. The black seed oil also addresses the oxidative stress on the heart caused by free radicals. So all of that medical jargon just means that free radicals are unstable atoms that are in your body that are just searching for mates. And as they go looking for mates, they destroy things that are in their path. They destroy other healthy cells that are in their path. And free radicals have the potential to damage the healthy cells in the heart muscle. And even if they aren't that healthy, just going through that path can just cause so much destruction. So those free radicals are called reactive oxygen species. And the reason why that's important is because black seed oil is an antioxidant. It stops that oxidative stress that we talked about. So when the free radicals attack the heart muscle, it can affect a lot of things that go on in the heart, from the use of calcium, which helps with the electrical signals that control the heart function. It can cause arrhythmia, or what's called an irregular heartbeat. It can cause necrosis, or what's called the death of the heart tissues. And it can cause like too little blood to flow through the area. So it just causes a wealth of problems and a wealth of issues that we do not want to deal with. And so it can also cause hypertrophy. All of these words, I'm breaking them down because it's just, I mean, it's a tongue twister for me sometimes too. But it can also cause hypertrophy, or thickening of the walls of the heart chamber so that the blood can't pump the way that it's supposed to through the chamber. All of these things. And so black seed oil, that active ingredient that we talked about, that long word, thymoquinone, it serves as an antioxidant to fight those free radicals that cause that oxidative stress and decrease that stress. Similar to how CBD decreases stress. It's decreasing all of that so that we can have great heart health. Now, studies have shown that inflammation, just like Dr. Tyus talked about, plays a huge role in the severity of heart disease. And black seed oil can inhibit or block the gathering of what's called those inflammatory cytokines. And I have to get deep into this so you can understand. I break it down so you can understand exactly what this black seed oil is doing. So if we're talking about those inflammatory cytokines, think of like an army coming in to take over the heart tissues. So then black seed oil comes in and says, oh, no, you won't. And it comes in like a huge wind gust and just knocks down that army and prevents them from attacking and causing damage to those heart tissues. I mean, it goes on and on. It strengthens the force of the heartbeat. And it does that by keeping the cells intact that are responsible for the beating. So, oh, sorry about that, CNN. It does that by keeping the cells of the heart intact that are responsible for the beating. Those cells are called cardiomyocytes. So it makes sure that those cells stay intact. And as you can see, the black seed oil just provides a hedge of protection over the heart when it's used consistently. And it has a whole lot of other benefits related to heart disease, including the ability to address depression. I mean, when you have chronic diseases, heart disease, hypertension, high cholesterol, what have you, sometimes it can induce a little bit of depression or a little bit of sadness because you're not able to function the way that you used to. You're not able to do the same things that you used to. And that depression is a result of the imbalance in the serotonin and dopamine in your brain. And so what CBD is going to do, like Dr. Rita said, is put your body back in balance. And in depression, it works the same way. The CBD helps the brain's chemical receptors to respond better in those in the brain. And it can make sure that the serotonin and the dopamine bind properly so that that imbalance is not there anymore. And something else I learned just today, actually, is that the CBD can kind of mimic the effects of the serotonin in your brain. So it addresses depression in that way. So CBD just comes in and does its thing, just like black seed oil does. So, you know, I know that was a lot. And, you know, I encourage you, just like Dr. Rita says, to go on your favorite search engine, Google or PubMed or Google Scholar or what have you, and just look at all of these scholarly articles. You can search black seed oil, you can search CBD, you can search Nigella sativa, as we said, with the black seed oil's chemical name, and watch how many pertinent articles populate about these wonderful oils. Our bodies are made for this, and they're just looking for components and oils and plant-based things and great foods to be able to break down and be used properly by our organ systems. So again, like I said, I know that was a lot. So if you do have questions, you can put them in the chat box and we can talk about them during our question and answer session. But if any come to you later after you look and you say, Dr. Joy, I don't know what you just said, can you run it back for me, please? My inbox is always open. My email address is drjoysmith14@gmail.com. As I stated, I am a Wakanapreneur, certified online dispensary owner. So here is my dispensary site as well. And I just am so excited to be learning with you all. As we prepare for these presentations, I learn with you all. So I'm so excited to have been able to teach you about how black seed oil can help with heart disease. And I'm going to give the floor back to Dr. Rita so she can talk about our amazing CBD products. Dr. Rita, take it away.
Thank you so much, Dr. Joy. And that was, oh, no, you won't, black seed. Oh.
Oh, no, you won't.
Not, oh, no, you won't, black seed, but oh, no, you won't, heart attack and heart
Absolutely.
disease. Black seed to the rescue, right?
That's right. That's absolutely
Yes.
right.
That was outstanding. So yes, Cheryl John, at the end, there was only one slide. Dr. Joy packed a lot of great information on black seed on one slide. So there you go. So we are going to continue, and I want to apologize for not giving my colleague her due introduction, but those are her credentials. Dr. Joy Smith is a PharmD, straight 6 years after high school, received her PhD, works at Cook County, where I completed my residency. And thank you again, Dr. Joy Smith. So we're going to move on to some of the products that I want to concentrate on as it relates to CBD and our men. And so we here at Wakana provide some of the most rich medicinal hemp that's fully compliant with the State Department of Agriculture, which means that our products are grown organically. Our products are also industrial hemp registered, and our products are Farm Bill compliant. That means that in the 2018 Farm Bill, it specifically states that the CBD has to be sourced from hemp and contain the legal limit of THC, which is 0.3% or less. We also are committed to the highest quality products, And we do that through showing our integrity in having certificates of analysis on every single product here at Wakana. Or certificate of analysis will allow you to see that the amount of CBD and other cannabinoids that we say are in the bottle are actually in the bottle. And that is critical during this time in this market to know that you are taking a product that is organic, that has been tested and is safe and effective. So again, I just want to reiterate, when you talk about chronic illnesses, be it heart disease, diabetes, arthritis, autoimmune diseases, obesity, all of these chronic conditions have a common denominator, and that common denominator is inflammation. If you attack inflammation, if you reduce inflammation, it's game over. How do you reduce inflammation naturally and holistically? Well, one way is through your diet, right? A lot of you don't want to hear it, but it's through your diet. Taking away fried foods, processed foods. You want to deal with food that is fresh, food that is plant-based. That's going to help to reduce the inflammation in your body and in your heart. CBD reduces inflammation. It's a powerful anti-inflammatory, as black seed is. CBD has been shown to dilate the vessels so that blood flow can be more appropriately going from the heart to the brain, or the heart to the kidney, or the heart to the liver. CBD has also been shown to lower cholesterol. Cholesterol is a big, big problem when it builds up in the arteries and can cause coronary artery disease. And CBD can help reduce anxiety and stress, right? We talk about the white coat syndrome. What that means is when you go to the doctor and as soon as we walk in with our white coat, you get a little anxiety and anxious. That can cause your blood pressure to go up. So CBD helps, again, to calm you down. How does it do that? Like we've all said tonight, releasing that dopamine and serotonin to help you bring your anxiety down. So this is how CBD protects your heart. CBD and hypertension, the same thing. We talked about hypertension, increase in the force of the blood. CBD comes in, is a vasodilator. It helps to relax the vessels. It helps to reduce anxiety. There are studies where they've shown that CBD does all of that and more. It reduces inflammation and it improves the muscle contractility of the heart. So the heart is more efficient. So it's not a snake oil. There's science behind how CBD works in the heart. Dr. Tyus talked about the CB2 receptors that are found in the blood vessels that are looking for CBD to put the body in balance. And then this is a very important slide. I just wanted you to see what we were talking about, how CBD actually has receptors on dopamine and serotonin pathways in the brain, so that when you need more sleep, or you need to be more calm, or you need to have a better mood, CBD comes in and helps to release more of those chemicals called dopamine and serotonin. So the science is just fascinating. So we're going to talk about some of the products in our Father's Day package. And the reason why I want to talk about specifically the products in our Father's Day package is because it's Father's Day on Sunday, and the whole month is centered toward improving the health of our men in our families, the men in our communities, the men at our jobs, the men in our lives. So the first product is our Hempranium 500. It's a CBD oil, which is a tincture. That means you place it underneath the tongue. Now we have a proprietary formula on this particular product, meaning that we've enhanced the CBD with black seed, turmeric, and peppermint. Now, Dr. Joy did a whole presentation on black seed just a couple of minutes ago, and black seed is amazing. So it is going to even enhance the anti-inflammatory, the anti-anxiolytic, the antioxidative properties that CBD has already. Turmeric, we all know about turmeric. That's another spice or essential oil that does everything, right? From inflammation to improving mood, to improving memory, to helping with pain naturally and holistically. And then peppermint adds a nice flavor to this oil. So this particular product, you want to start low and slow. 3 drops in the morning, 3 drops in the evening is a great way to address a healthy heart, to address issues that relate to heart disease in men and women. Now, what's great about CBD is that the majority of people don't need a lot of CBD. That's why I always like to recommend starting low and slow, knowing that you can go all the way up to 15 drops twice a day if you need it. The next product is our topical liquid relief, or our Dr. Rita's Rub. It's one of our topical products that has 200 milligrams of CBD along with 19 other essential oils that address pain, that address inflammation, right? We understand that if a man has joint pain due to arthritis, or maybe pain due to gout, that pain can cause an increase in anxiety, which can increase blood pressure. So we want to make sure that our men have as minimum amount of pain in joints, knees, hips, back, as possible. So this is a topical product that you can use as you are starting topical products. Just know you don't need a lot of this either. 1 to 2 drops in an area is all you need. More is not better. Our next product is our Diamond Life Pre-Roll. This is a CBD joint. Now remember, none of our products get you high. None of them cause a paranoia. Why? Because our products are sourced from hemp and not marijuana. So this pre-roll is a great product that works very, very fast. Within 1 to 5 minutes, the CBD gets into the bloodstream. It's a great product for those men who have issues with anxiety that leads to elevated blood pressure, to pain, to men who are smokers. We said one of the risk factors to heart disease is what? Smoking cigarettes. This is a great way for those men in your lives who may still smoke cigars or cigarettes, none of which is healthy. This product is a product you only need 1 to 3 pulls. That's it. You don't need to smoke the entire pre-roll to bring down your anxiety, or to help you sleep, or to help the depression, or help the inflammation in the body. A great, great product. And then our gummies. I recommend the gummies, 1 gummy every night to help you sleep. When you sleep, your body repairs itself. When you sleep, your immune system resets itself. So during this pandemic, we want our immune system to be the strongest it can be. 1 gummy is 40 milligrams of CBD. CBD gummies take about 30 to 40, maybe 90 minutes to get into the bloodstream. So that's why I recommend about an hour before you go to sleep, give the man in your life a gummy. Not only is it going to help him sleep, it's going to also help reduce inflammation in the body. Remember, the whole goal is to decrease the inflammation in the body. To decrease inflammation in the body will help to prevent future heart disease, and to help to reduce those who already have heart disease, the inflammation in their body. So 1 gummy, these are our broad spectrum gummies. Our broad spectrum means, and I didn't explain this, it means that it contains less than 0.0% of THC. So this particular product is very safe for those who have random drug screens at their job. Our topical products, again, they do contain the legal limit of THC, which is 0.3% or less, but when you use a topical product, they don't pass the blood-brain barrier. The Diamond Life pre-roll, I meant to say, it is a product that contains the legal limit of THC. So if you are at a job that does random drug screens, the pre-roll is a product that you do not want to use because it potentially could show in your bloodstream. Our broad spectrum gummies also come in a 4-count pack. So just to sum it up, we can't get past a healthy, active lifestyle, right? A great diet, consuming a plant-based, a diet that is free from processed foods and fried foods. All of those things increase your risk. Smoking increases your risk. Excessive alcohol increases your risk. Carrying a lot of weight in your abdominal area increases your risk for heart disease. Having a lot of stress and anxiety increases your risk for heart disease. Having inflammation in your body increases your risk for heart disease. So we want to bring all of that down. We want to bring your body into balance, and we can do that very safely and effectively with CBD and essential oil. So we want our men to be strong. We want them to be healthy. We want them to have the best advantage for living as long as they can with a holistic and natural approach. Again, I do this every Wednesday. I'm opening my weight loss management Facebook group to any man that is referred and on our products who want to lose weight, because we understand the synergy with CBD, the black seed oil, our essential oils, with a diet plan and good exercise is the key. That's what makes CBD magical, right? When you take the science and you take the holistic approach to life, that's what makes it magical. So our Father's Day package, again, we recommend to all of the men in your lives. It includes the topical product, our Hempranium 500, our broad spectrum gummies in the 4-count pack and the 16-count bottle, our pre-roll, and a beautiful card, along with black seed oil. If you want to give an additional blessing to that man, you can also order the black seed oil. All of this information has been so powerful. I want to thank my colleagues for joining me tonight. We're going to take questions right now from the audience, but I want to just let you know that whoever invited you on the call, number one, they love you, honestly. And number two, we want you to contact them after we take your questions, answer anything that you have. We want you to contact them so that you can get your products ordered and get your questions answered, and you can lock arms with us here at Wakana to make your men and your life healthier. So we're going to take questions, Dr. Joy and Dr. Tyus. I don't know if you can read them, but one question says that the pre-rolls has helped my husband with snoring at night. Oh my God, we know about sleep apnea. I tried to keep them well stocked in our household. I'm tremendously grateful, and we swear by the gummies in our house lately. I've had to take 2 gummies before bed. I'm grateful for Wakana products. Thank you. Well, thank you, Keisha Townsend, for that testimony. We are excited that our products work, and our products are tested, and our products are safe and effective. Thanks, ladies. This was fantastic. Dr. Joy said, oh, she's commenting to Keisha Townsend. Wow, Keisha, I will need to have my husband use the pre-rolls for snoring. Yes, sleep apnea is a big problem. And again, if we can use anything to help with that, absolutely. There are lots of studies that show how CBD helps to improve sleep apnea.
Dr. Rita,
yes.
Dr. Rita, this is Dr. Tice. There was a couple of questions regarding leg well, foot and ankle swelling.
Yes, if you could address that. Thank you.
Yeah. So once again, want you to get back with your primary care doctor or your cardiologist, depending on what is the cause of the swelling, which was most likely the heart failure, and make sure that you're on your optimum, medicine that you have. But as we mentioned, the CBD will help with homeostasis and hope that would help with the swelling. So the tincture that Dr. Rita mentioned may be a better product for you to use, and also consider the aromatherapy too as well, because that helps out with the olfactory receptors and some of the other receptors to cross over. But with the swelling, and there was someone who mentioned 25%, I guess that was ejection fracture, the ability for your heart to pump.
Yes.
Make sure you are following up with your cardiologist with that low number. And, make sure we mention looking at the salt, looking at processed foods. It's not necessary that might not be adding salt in your food, but there's salt in a lot of processed shelled, things. So you want to be kind of cautious with that and try to get some of the plant-based. But hopefully that answered the question regarding the ankle swelling, to consider one of the products as the tincture.
So what is the recommended sodium intake daily for someone who is hypertensive? Because you really want to read your labels, ladies and gentlemen. Dr. Crawford.
Right. So the average person is 2,300, and that's actually a teaspoon. So someone,
2,300 milligrams is like a teaspoon of salt.
right. So actually someone who has heart failure, it's recommended less. And it, like I said, depending on, someone mentioned Lasix, the water pill, there's a gentle balance between, salt and fluid. So usually your specialist would recommend less. So throw away the table salt, and also look at your labels.
Thank you so much. Question from Cheryl. Is it possible to get off blood pressure medicine?
Well, anything is possible, especially for someone who's really, truly dedicated, but it also depends on your baseline and how the duration of the blood pressure that you've had. So it is possible. I can give you a personal note that when Dr. Rita and I met, I was probably 35 pounds over what I should have been. And I actually had chest pain exercising, finally got that looked at, and all I actually need to do was lose the weight and look at my diet. And I have two parents who had high blood pressure, so the genetics that I mentioned could be a factor, the environment, growing up eating the things that your parents' family ate, but changed my eating habits, lost weight, exercise, and I've have been off my medicine for a couple of years at a time, on my medicine for a couple of period of time. So I know, depending on stress and weight, my blood pressure does come up, and I, as a doctor, do take my medicine. I do follow my provider's recommendations. However, I don't like, as a doctor, I don't like to be on medicine either, because of just side effects with the kidney and the heart and liver. So, but I do with my doctor, we work together. But yes, it's possible to be off medicine at some point, but you have to be really dedicated and monitor what's going on. And I've used the gummies at night and the Power Hemp Premium, and that has helped if I happen to miss some of my pills.
Got it. Yeah, it's really important that you do not stop taking your medication, right?
Correct.
I personally use a gummy every night. I use the Hempranium 500 twice a day. I use the hemp powered hair twice a day topically. I will use my vape cartridge with high stress times, and absolutely I pre-medicate my muscles before my workout with the Dr. Rita's rub. I mean, I like fell upon doing that. I was like, you know what? When I work out, my workouts are much more effective when I pre-medicate with the Dr. Rita's rub and rub it on my left shoulder, right knee, and lower back. Those are my problem areas. And I'm telling you, it has been amazing. Another thing I do is I use the Dr. Rita's rub at night. So those who have issues with sleeping because of pain, I put that Dr. Rita's rub on that knee and I sleep with that gummy like a baby. So it's a great way to use the products, all the products in the different methods of getting it into bloodstream depending on what you're trying to address. So we're going to take a couple of more questions and then we're going to call it a night. Sorry, it's a little longer. We've gone 10 minutes longer. I also take black seed. Yes.
Oh, I'm just saying, I saw the Himalayan salt.
Yeah, address that.
So people think that the Himalayan salt is, quote, better. But if you pile on a tablespoon of salt, it's not going to be, because that salt is more concentrated. So once again, try to avoid salt. Try to table salt. Use, there's so many different flavorful herbs out there that you can use. That would be my recommendation, especially if you have severe hypertension or heart disease.
Yes. I use Mrs. Dash too. I use Mrs. Dash, the unsalted. I don't have any issues with my blood pressure, so I use our CBD seasoning spices. So please, if you have hypertension, heart disease, please limit your sodium intake. Any other questions, ladies, that you see?
There's a few in the question and answer
Okay, if you could address
section.
those. It says, can the relief be combined with the lotion as to stretch the product, or should it be used directly from the bottle into the skin? It's more effective, Fred, if you use it directly from the bottle, but you can absolutely combine it with your lotion if you like. You don't need a lot. 1 to 2 drops is all you need. I've been informed that I snore and grind my teeth in the sleep. Can CBD help me? Well, you know what? There are studies that show that CBD actually has some benefits in those who not only have sleep apnea, but who have TMJ. In fact, I did a presentation on TMJ. And it all has to do with 1, reducing inflammation, 2, being an analgesic, and 3, helping to release more of that serotonin and dopamine so you can get that rapid eye movement, deep sleep. I notice when I take Power Hempranium, my stomach aches, but not when I take the pure Hempranium. Any side effects? And it could be. There are some people, Maggie and Amberly, that I'm noticing they have a sensitivity to the turmeric that is in the Hempranium. The turmeric is also in the pure, but at a lower level. So the proprietary formulation in both the Power Hempranium and the pure Hempranium is exactly the same. So it could be the mechanism of the nanotechnology that makes the delivery into the cells less harsh on your stomach than the Power Hempranium. So I'm glad that you found out that you can take the pure Hempranium. Everybody is different. That's why I always recommend starting low and slow so that your body can be adjusted appropriately to CBD. To my panelists, Dr. Crawford, Dr. Smith, you women were absolutely amazing. Thank you so much for joining us. Thank you for educating, empowering our attendees tonight on heart disease, men, and CBD. Have
Thank you for having us.
Thank
great
you again.
evening. Thank you.